So in this case, I think my colleague from Vietnam has done a very good job. I think he used a tool we call affirmation, which is basically trying to emphasize what the patient is doing well. And I think it's a very effective way to motivate a patient to stick to something. He might have been optimized his way of interviewing the patient by the use of what we call open-ended question. These type of questions where you cannot answer by yes or no help the doctors to get more information in order to help the patient. If we focus on the patient, I think this patient is really into action. He's doing what his doctor is expecting from him. He's sticking to non-pharmacological means. The risk in this patient is basically what we call relapse. So the doctor needs sometimes to minimize his motivation by reducing his objectives, that are what we call micro-objectives. Finally, you can see that this patient is very much involved in his family life. He's what we call the facilitating patient. In this setting, it will be of use to get the help of the family in supporting the doctor's action to control blood pressure in this patient. I think this case is very interesting, and my colleague from Vietnam did a great job. He identified basically by the use of very specific question a patient who is basically into what we call the relapse phase. This patient has stopped taking his medicine, and I think this is a very important issue which could be linked to the fact that his blood pressure is not controlled. For me, this was the most important step in this case, and I think that in this particular timing, the doctor and the patient have to focus on this issue about non-compliance. If you look at the way the patient has been dealing his medicine, you can really easily understand that he's an analyzing patient. It's a patient which is driven by security, by the fear of having elevated blood pressure. I think this is really important because this will help the doctor to find the right arguments. In this typical situation of a patient who is an analyzing patient who stopped taking his drugs, the use of a tool we call the decisional balance could be of very much help. By asking the patient what are the advantages and disadvantages of taking the pill and compare it to the advantages and disadvantages of not taking the pill, the doctor and the patient are able to come up with results and data which can help both of them to cope with their hypertension. This case of my Chinese colleague is basically using all standards in order to realize a perfect intervention about motivational strategies for patients with hypertension. If we focus on the patient case, you might see that this patient is what we call a facilitating patient, which believes that hypertension is a kind of fatality and is concerned by some security issues. In this particular patient, the use of what we call the benefit-risk ratio could be useful. If you might emphasize the benefits of antihypertensive therapy and you might minimize the risk, it's a way to help this patient to cope with pharmacological treatment of this disease. I totally agree with my colleague from China about the fact that this patient is what we call the facilitating patient. But if you would like to go a little bit deeper into the analysis, this patient is what we call a borderline personality, mixing items from what we call the facilitating personality to items from what we call the analyzing personality. He also identified nicely that this patient is into the action phase, and I think that for this patient now the challenge will be to identify high-risk situation leading to what we call relapse. So two very important points: try to minimize tasks in these patients, try to stick to what we call micro-objective in order to avoid relapse, and again use the tools used by our colleagues from China, which we call affirmation, where you try to boost self-esteem of your patient. So what have we learned from this case managed by our colleague from Brazil? First, that this patient is what we call the promoting one. He's very self-confident, he's taking the lead on his disease, and he's into what we call an action phase regarding drug management. He's sticking to his pills, he's taking his pills. But this case is also very interesting, showing you that you can be into action for some tasks, but into another stage of changes for another task. In this case, regarding lifestyle modification, the patient is totally into denial. So having a promoting patient into denial means that you have to show him that he's not so unbreakable. You might use experience in his life to convince him to change and try to stick to new rules according to his lifestyle. On the other side, regarding the action stage of changes for drugs, the risk here is to have him relapsing, having this patient stopping to take the pills. So, as nicely shown by our colleague from Brazil in how he wants to manage this patient, try to maintain the patient into action for him taking the pills, and try to change his behavior, maybe by showing him that he's not so unbreakable about his lifestyle modification. Now it's your time to play. We have created this game, these play cards, to help you to learn how to use the tools we have been through in order to better communicate with your patient suffering from hypertension. It's a very easy to use tool. Basically, you will play with these cards depicting different type of patients and different trait of personality. You will be challenged by the use of the second sets of cards, where basically you will be asked to try to motivate your patient to follow a defined task, taking his pills, for example, or dieting, or doing regular physical activity. In order to help you, we have also created these reminder cards, which are basically defining all the tools we have been through during this session. I hope you will enjoy the game as much as we did.